Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for Chapter 9, Diseases of Circulatory System Part 1. So, now let us discuss the various topics that are covered under this chapter. From Chapter 9, you have 5 guidelines. Guidelines regarding hypertension, guidelines regarding atherosclerotic coronary artery disease and angina, intraoperative and post-procedural cerebrovascular accidents, sequelae of cerebrovascular disease, acute myocardial infarction AMI. In the current session, we will be discussing a part of hypertension. Now, coming to the various codes related to hypertension are essential hypertension, that is given by I10. This is the final code. Hypertensive heart disease, which is given in the series I11 dot. It is further expandable. Next, hypertensive chronic kidney disease. The code series is I12. Next is hypertensive heart and chronic kidney disease, which comes under I13. The dash indicates they are further expandable. Next is secondary hypertension, which comes under I15. And finally, hypertensive crisis, which comes under I16. So I10 is essential hypertension, I11 is coded for hypertensive heart, and I12 is coded for hypertensive chronic kidney disease. I13 is coded when there is hypertensive heart and chronic kidney disease. This is a combination code. Next, secondary hypertension is given by I15 and hypertensive crisis is given by I16. Now, hypertension. Generally, the classification, ICD-10cm classification, it presumes a causal relationship, cause and effect relationship between the two conditions that are linked with the term with in the alphabetic index. If you refer the alphabetic index for hypertension, then you can see under hypertension with will be given for heart involvement, kidney involvement, and for both heart and kidney involvement. So hence it is linked with, we need to presume a cause and effect relationship. We need to presume that two conditions are related. These conditions should be coded as related even in the absence of the provided documentation, explicitly linking them, unless the documentation clearly states that the conditions are unrelated. They are hypertension with heart involvement, which is given by I11 series, hypertension with kidney involvement, which is given by I12 series, and hypertension with heart and kidney involvement, which is given by I13 series. Now coming to hypertension with heart disease. Hypertension with heart conditions classified to I50. The codes which govern heart failure are come under I50 or I51.4 to I51.7 and additionally I51.89 and finally I51.9 are assigned to a code from category I11, hypertensive heart diseases. So whenever hypertension is with these heart conditions that come under I50 series, I51.4 to I51.7, I51.89 and I51.9. Then you need to assign I11 for hypertension, not I10, which comes under essential hypertension. You need to assign I11 here. Whenever hypertension is associated with heart disease, you need to code I11 for hypertension, which is given by which is coded as hypertensive heart. Now coming to the subcategories of I11. It is again categorized into I11.0 and I11.9. These are the final codes. I11.0 is coded when hypertension is associated with heart failure. Hypertensive heart with heart failure. You need to use additional code to identify the type of the heart failure which comes under the series I50. So I11 series is further categorized into I11.0 and I11.9. So whenever hypertension is associated with heart failure, first you need to code PDX as I11.0 followed by type of heart failure as SDX. The second is I11.9, hypertensive heart without heart failure. There are other heart conditions other than heart failure which come under I51.4 to I51.7 and I51.89 and finally I51.9. For all these conditions, first you need to code I11.9 followed by these conditions. Here you can see the overall list of heart failure codes. For detailed explanation regarding the heart failure topic, you can refer one more video on heart failure. I'll put that in the description. So as of now, here I am briefly discussing only in one slide. Heart failure is categorized, I50 series is categorized into I50.1 which comes under left ventricular failure unspecified. This is a final code. And systolic heart failure is given by the code I50.2. This is further expandable. Diastolic heart failure is given by the in the code series I50.3. This is also further expandable. Next, combined systolic and diastolic heart failure comes under the series I50.4. And other heart failures comes under the series I50.8. This is also further expandable. And finally, unspecified heart failure I50.9. So whenever hypertension is associated with these conditions, either unspecified heart failure or systolic heart failure or diastolic heart failure or combined systolic and diastolic heart failure or other heart failure, or left ventricular failure. In all these conditions, first you need to code I11.0. First, for hypertensive heart failure, first code I11.0 as PDX, followed by type of heart failure as SDX. This is the ground rule. Here is the list of conditions where we can code I11.9. For hypertensive heart disease without heart failure, first code I11.9 as PDX followed by any code from the above table as SDX. So here in the beginning you can see under the guideline the codes under the category I51.4 to 7 followed by I51.89 and I51.9. In these cases you need to consider I11.9, that is hypertensive heart disease without heart failure. The conditions are I51.4 which indicates myocarditis unspecified. If the physician documents chronic myocarditis, chronic interstitial myocarditis, then also you need to code this code only. If the physician documents myocardial fibrosis or simply myocarditis NOS, for all these terminology you need to code I51.4. And coming to I51.5, it indicates myocardial degeneration. So you can code I51.5 for myocardial degeneration, fatty degeneration of heart or myocardium. For myocardial disease, if the physician documents as myocardial disease, then also you can use the code I51.5. And if the physician documents senile degeneration of heart or myocardium, in all these terms, whenever any of these terms is specified in the document, you can use I51.5. And I51.7, it is given by, it indicates cardiomegaly. If the physician documents either cardiac dilation or cardiac hypertrophy or ventricular dilation, in all these cases also you need to quote cardiomegaly only. And finally coming to I51.89, other ill-defined heart diseases. For carditis acute or chronic and for pancarditis acute or chronic, you need to code I51.89. And finally I51.9 for heart disease unspecified. So for all the conditions that are listed in this table, whenever the physician documents any of the above conditions and along with hypertension, then you should code I11.9, not I10. I11.9 as PDX followed by any code from the above table as SDX. So it is clear that hypertension with heart conditions classified to I50 series, I50 series or I51.4 to I51.7 and I51.89 and I51.9 are assigned to a code from the category I11, hypertensive heart disease. Use additional codes from the category I50 heart failure to identify the type of heart failure in those patients with heart failure. The same heart conditions I50 series or I51.4 or I-51.4 to I-51.7, I-51.89 and I-51.9 with hypertension are coded separately if the provider has documented that they are unrelated to hypertension. If these conditions, if they are unrelated to hypertension, then you need to query the provider and sequence according to the circumstance of admission and encounter. When the physician documents they are unrelated, then you should not use I-11 code and you need to query the provider. In 90% of the cases, it will not be the scenario. Let us discuss the examples. A patient visits for regular follow-up. Patient has past medical history of diabetes, is on metformin, and patient has HFrEF, that is heart failure with reduced ejection fraction, hypertension, and is on amlodipine. No other complaints today, medication refills. So here the patient is having diabetes, hypertension, and heart failure. So the appropriate codes would be first E11.9 to indicate type 2 diabetes mellitus without any complication, followed by I11.0 hypertensive heart with heart failure, and patient is having heart failure with reduced ejection fraction. The code for that is I50.20 heart failure with reduced ejection fraction, followed by long-term current use of oral anti-diabetic drug because patient is on metformin. Z79.84. So these are the correct appropriate codes for this scenario. Next example, a patient visits for regular follow-up, past medical history of hypertension and patient is suffering from cardiomegaly. Here patient has hypertension and patient is suffering from cardiomegaly and physician did not mention that it is unrelated. So you need to assume a cause and effect relationship. Hence, you need to code I11.9 hypertensive heart without heart failure followed by I51.7 to indicate cardiomegaly. Now, let us see one more example. A patient visits for regular follow-up, past medical history of hypertension and diabetes. Here, patient is having only hypertension. So, you need to code I10, that is nothing but essential hypertension, followed by E11.9 type 2 diabetes mellitus. I hope you understood when we need to code I10, when we need to code I11. In the next session, we will discuss about hypertensive chronic kidney disease and further topics. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.